But let's switch gears from price to science. You know,
Mhm.
I'm Googling all the time how to look younger, how to look better,
Well, you look great,
how to lose weight with not stopping eating, all of those things. And but when somebody comes in feeling exhausted or not performing like they used to at a younger age, what does a full longevity evaluation look like when they come to you?
That is a really great topic that really is so near and dear to my heart, because oftentimes patients just base their wellness on their annual physical, right? They see their primary care doctor or their internist and say, well, you have a clean bill of health, nothing's wrong with you. But really, you have to go deeper than those baseline labs. I check levels of vitamins, minerals, which our food and our soil is depleted of minerals, as well as antioxidants, NAD levels, and these are all levels within the cell. So these are intracellular levels of all of these different nutrients. I also check your biologic age, your rate of aging, and the age of your organs. So I like to take a more comprehensive, advanced approach to when it comes to your biomarkers, right? And we track these over time. And with our interventions and our treatments, we're able to show patients, when you came to us, you actually were deficient in vitamin B6 or B2 or glutathione or vitamin C or alpha lipoic acid, many of these biomarkers that are measured within the cells. And now we've put together a treatment plan specifically for your deficiencies. You would be astonished by the improvements and the outcomes that people are experiencing just with running some simple diagnostics. And so patients see the value in that. We're not just guessing, oh yeah, you need B complex or you need an IV with B12. We actually take the time to do the diagnostics and really personalize the interventions for patients. And as you know, as we get older, our bodies become deficient in NAD and hormones. Our metabolism slows down. We're more susceptible to infections and frailty. So all of these things are important things to look at and to really take the time to treat.
Sure. Anyone my age knows all about that. So yes, I agree with you. And taking a multiple vitamin every day doesn't really cut it, does it? So your longevity panel, which I assume is what we're talking about with this, the testing that you do and the results that you get, is intense about you mentioned the micronutrients, the intracellular. What you mentioned NAD. What's NAD?
NAD is a cofactor that's found in every living cell of your body, and it is responsible and facilitates energy production. So it works directly on the mitochondria. Mitochondria are these little organs that exist within the cell. So their specific role of the mitochondria is to support your energy metabolism. So when it comes to the fuel that fuels your body is ATP, NAD is what supports the production of ATP.
Oh,
so
okay.
As we age, we know that NAD production declines with age. And so what we do at BODYWELLE is that we check your NAD levels, and oftentimes patients are either deficient, severely deficient, or suboptimal. So we try to get them in the green to the optimal range. And when we do, they have better energy, they have less brain fog, they're able to think more clearly, better physical performance, improved stamina, and it actually has been shown that optimal levels of NAD can reduce your risk of chronic illnesses like neurodegenerative disorders, cardiovascular disease, cancers, and arthritis, and many others.
Wow.
So optimizing your levels of NAD will make you feel good, but it's also good for you in the long term.
Wow, that's great. I can't wait to come to your office. This is good.